What's up, guys? This is Dr. Yazan, and welcome back to episode 2 of Clotcast. This is a podcast all about blood clots and blood disorders, which are diseases that I treat every day as a hematologist. So I'm quite excited to be talking to you guys about this. Thank you all for tuning in to last week's episode 1, which was about defining what a blood clot is and what thrombosis means and how to recognize the symptoms of a deep vein thrombosis, a pulmonary embolism, or a lung clot, heart attacks, and strokes. And a lot of you guys had a lot of great feedback, so thank you so much, and pointers to remember to turn the microphone on this time, so I remember to turn it on. And a lot of you also asked about prevention, how to prevent blood clots, and I think that's a very important question. It's important to first address what causes blood clots and what are the risk factors for blood clots this episode in order to set the stage for the next episode, which will be all about prevention. And I'm excited to share that it will feature a very special guest and a dear friend of mine. So today I want to talk to you about the causes of blood clots and the risk factors for blood clots. Who are the people who are at risk and why and how do blood clots happen? Before getting into that, it's important to first talk about normal clotting or the good type of blood clots. Our body has a way to make sure that whenever we injure ourselves, we don't bleed excessively and hemorrhage to death. As humans, we're prone to a lot of injuries. We fall over things, or things fall on us, or we punch each other, we step on sharp objects, we cut ourselves, trample over objects and hit our heads. And imagine if every time something like that happened, we couldn't clot properly. We would just keep bleeding into our brains or in our insides or hemorrhage profusely, and that could lead to death or serious complications. So our body has to have a way to clot properly in order to prevent excessive bleeding. So this is the natural or normal type of clotting. And how does that happen? It is a complicated process, but to simplify it, it involves blood cells, primarily platelets, as well as clotting proteins or coagulation factors. The platelets are the cells that help stick to the site of injury or the inner lining of the injured blood vessel, known as the endothelium, with the help of a protein called von Willebrand factor, hands down the most interesting molecule in the human body. More on that later. And the platelets can activate each other and stick to each other and clump together to form a little plug, and also help activate different clotting proteins that all work together in synergy to form a final product called fibrin, which forms a mesh-like substance that helps keep the clot in place. As a result of that, you have a clot that is a mixture of platelets and fibrin and different proteins that forms a scab. So whenever you cut yourself and you see a scab, that's what it is. It's a mixture of fibrin and platelets and different cells and proteins that come together to form this substance that allows the bleeding to stop and also allows the blood vessel to heal and not keep bleeding excessively. And so normal clotting is such an important and essential part of our lives that keeps our bodies functioning properly, because that's literally the reason why our blood is able to flow through all of our vessels and arteries without getting clogged and without leaking everywhere. It is so important, and it's a complicated and intricate process that is also very beautifully regulated, and any defect in that process can lead to serious complications. If there is too little clotting, for one reason or another, that can lead to bleeding disorders, and there's many of them. You may have heard of hemophilia, for example. And if there's too much clotting, too much activation of the system or the clotting proteins or platelets and so on, then that can lead to blood clots, the bad kind of blood clots, which means this is a disease state and the blood clot is happening not because it is needed. It's happening abnormally to the point where it may in fact obstruct blood vessels, obstruct the blood flow in our veins or arteries, and lead to serious complications that I described in episode 1. A lot of people ask, what causes the bad kind of blood clots? Why do they happen? How do they happen? And that's what I want to answer today. In reality, there's a lot of different factors that can lead to thrombosis or cause blood clots. There's environmental factors, medical factors, medications, genetic factors, and so on. The simplest way to categorize them is based on what is happening within the blood vessel. Back in the 1800s, Dr. Rudolf Virchow, who was a renowned German physician, described something known as Virchow's triad, which is the three main categories of the causes or the factors that can cause thrombosis or lead to blood clots. The first one is endothelial dysfunction. What does that mean? Endothelium is the inner lining of a blood vessel. Whenever there's something wrong with the inner lining of the blood vessel, such as endothelial injury or dysfunction, this means that there's an abnormal function of that inner lining due to a disease state or many other causes, then that can lead the blood vessel to form a blood clot. That's one. Number two is hypercoagulability. Hypercoagulability refers to an increased production or excessive activation of our clotting system, including the clotting proteins, platelets, anything in between. And this can also be caused by many different things that increase the risk of blood clots. And lastly is venous stasis. Venous stasis means the blood flow within the vein is either too slow, the blood is not flowing properly, or there is turbulence in the blood flow within the vein, and that can also lead to blood clots. So now let's get to the specifics. What are specific examples of certain diseases or factors or conditions that can trigger blood clots through these mechanisms? Most of the time, blood clots, and today I'm referring specifically about venous blood clots, not arterial blood clots. Arterial ones need an episode of their own. Deep vein thrombosis, so these are the blood clots in the deep veins of the leg, or pulmonary embolism, which is a lung blood clot. And together we refer to them as venous thromboembolism or VTE. Most of the time, venous thromboembolism is caused by some sort of trigger or risk factor that we can identify. However, about 25% of the time or so, we don't find the cause or risk factor. We call that idiopathic or unprovoked blood clot, which I will discuss at a later time. For the majority of the time, when there is an identifiable risk factor or trigger, most frequently this can be related to, let's start with surgery and hospitalizations. So surgeries and hospitalizations are some of the most common causes of provoked blood clots. The reason that happens is with surgery, for example, there is endothelial injury due to the surgery itself. There is hypercoagulability that can happen due to the inflammatory response. Inflammation is a broad term which refers to our immune system response or reaction to different triggers such as infection, trauma, chronic illnesses, and so on. And that on its own can sometimes activate the clotting system and increase the risk of thrombosis. Surgery can also lead to venous stasis, for example, either due to the surgery itself being under general anesthesia, or, for example, with orthopedic surgery, it can be followed with days to weeks of immobility. And immobility on its own is another important risk factor for blood clots because immobility slows down the blood flow, particularly in our legs. And that's why going on a very long road trip without breaks or going on a long flight overseas can be risk factors for blood clots. And so it's important if you're traveling far away, you're going to be stuck in a plane or a car for more than 6 hours, to make sure you're moving your legs and taking breaks to get out of the car or get out of the airplane seats to help the blood flow, to help restore the blood flow in your legs. Hospitalization is another important or common risk factor for blood clots. Patients who are in the hospital are often, you're laying in a bed, maybe immobilized, you're dealing with a bad infection or some severe illness or an inflammatory response, a car accident. You're getting a lot of medication. So a lot of this can also lead to blood clots, either during the hospitalization, which is why for most of our hospitalized patients, we give them blood thinners to prevent blood clots, and after the hospital course as well for high-risk patients. So it's important to recognize the symptoms if you are a patient in the hospital or who just left the hospital or just had a surgery. Another very important and common risk factor for blood clots is pregnancy. Pregnancy can increase the risk of blood clots almost 5-fold in women and can occur during the pregnancy or more commonly in the postpartum period. And that risk can persist for up to 6 weeks postpartum. The reason this happens is due to the effects of estrogen. As the pregnancy progresses, especially towards the third trimester, the estrogen levels are very high. And estrogen is a known cause or risk factor for blood clots. And it does so through activating the coagulation system or different clotting proteins or increasing the production of them. And that's also the reason estrogen containing oral contraceptives are a causative factor. The incidence is very low. It's very, very uncommon for them to actually cause a blood clot, but they can. So it's important to also know your risk factors before starting an oral contraceptive. And that leads me to the next point, which is family history. Family history is very important because it can give us clues about a genetic predisposition, particularly if there are multiple family members who've had blood clots, especially at a younger age. And there are different genetic mutations that can be passed down that increase the risk of blood clots. And we are able to test for many of them, although now as science evolves and we're able to better understand genomics and test for them, we're discovering more and more that can be tested. So if you do have a family history, do point that out to your doctors because you may be indicated or the affected family member may be indicated for testing. And sometimes that can help in decision making or at least in counseling, especially if you're about to be subjected to a blood clot provoking trigger, such as a surgery or getting pregnant or starting an oral contraceptive and so on. Another very important risk factor I want to cover today is chronic illnesses. Chronic illnesses are so common and affect such a huge proportion of the population. And this includes things such as hypertension, diabetes, hyperlipidemia or high cholesterol, obesity. All of these things are risk factors for blood clots through causing endothelial dysfunction, hypercoagulability, venous stasis, all the above. So it's very important that should you have these conditions to make sure that they're being treated and monitored regularly. And this also goes hand in hand with healthy lifestyle habits, making sure you have a healthy diet, you exercise regularly, you're not smoking. And this is something we'll cover in more depth in next week's episode about lifestyle modifications, healthy habits, ways to prevent blood clots that you can do every day. There are certain diseases that are more likely than others to increase the risk of blood clots or directly cause blood clots. And a common one is cancer. A lot of times cancer patients can develop blood clots. In fact, many times they lose their battle to cancer because of a blood clot. And also, in reverse, sometimes we diagnose the blood clot first, and it is what leads us to discover the cancer diagnosis, meaning that the cancer presented with a blood clot as a first symptom or as a first complication. And that's why in a lot of my patients, that's something to always consider, especially if they have signs or symptoms that would warrant further investigation. Now, that doesn't mean that if you have a blood clot, you have cancer or you have a high likelihood of cancer. It just means that we should consider that possibility if there are reasons to suspect cancer. So to recap, the most common causes of venous thromboembolism or blood clots in the veins, meaning DVTs, so deep vein thrombosis in the legs, or pulmonary embolism, a lung clot, include surgery, hospitalization, immobility, pregnancy or hormonal factors, chronic illnesses, aging. I didn't talk about aging today. That probably needs its own episode, as well as cancer. What else am I missing? These are the major ones. There's other rarer causes, and there are rarer diseases that cause blood clots that I'd like to talk about in the future, such as TTP and antiphospholipid syndrome and many others. And I hope you guys found this helpful. Please let me know what kind of questions you want me to talk about in future episodes, and I'm more than happy to cover them. Let me know in the comment section. Please tune in for the next episode, which is going to be about lifestyle modifications and prevention with a very, very special surprise guest and dear friend of mine. I'm very excited for you to see the next episode. And thank you all for tuning in.